Hello everybody. My name is Liang Feng Wong. As you can tell from my name, I'm actually from Southeast Asia. I'm actually from Singapore. And I've been at Bristol for a number of years now. I came over to Bristol to my PhD. I'm a basic neuroscientist, and my interests are in regenerative medicine. My research is based on spinal cord injury and looking at the molecular basis of neurodegenerative diseases, so things like Parkinson's and Alzheimer's disease. So that's my research, but in one of my many roles, I'm also the Faculty International Director for the Faculty of Health Sciences, in which medicine space. And I also co-lead Year 4 Medicine within the MBCHB program. So hopefully today I'll be able to answer some of your questions on medicine and give you a taste for what sort of learning you'll be experiencing during medicine. So that's my background. Sumi suggested that I give a taster guest lecture or a teaching session. So I thought, it'd be interesting to go through a case-based learning sort of session, a very abbreviated version of a case-based learning session with you. So if you're interested in doing medicine, you'll be pleased to know that at Bristol, the structure of the curriculum is such that you learn medicine through case-based learning. You might have heard of that. That happens at other medical schools. Another term would be problem-based learning. So what is case-based learning? So case-based learning is a form of inquiry-structured learning. So what typically happens is that you have a clinical case or a problem or a question, and it's meant to be provocative. It makes you think about what's happening in the case, and then you go out and explore a little bit more at greater depth some of the issues around that case. So it provides a framework for you to actually learn, because what we want is to encourage independent learning for you to find answers to questions yourself with some guidance. So what happens with case-based learning, or what we call CBL, within medicine, is that you work in small groups, so 10 to 12 students in a group. You have the same group throughout the year. In fact, actually, for the first 2 years, you will have the same CBL group. And every 2 weeks, in year 1 and year 2, every 2 weeks, we'll give a case to the whole cohort of students. And it will come with some case information. It comes with a set of learning objectives. It gives you information about the case before we actually do the CBL sessions, and then more information gets released during the course of the CBL session. And it's also supported by tutorials, lectures, and more traditional lectures that you're used to, practicals, etc. So you're not just given a case and then just go away. We will give you teaching sessions, things like anatomy, dissection sessions to support that case. So CBL starts in year 1 at Bristol Medical School, and it actually continues throughout the curriculum. So it starts in year 1. In year 1, we start with easier cases, so cases that look at normal health and disease. So normal health. So you look at what's normal physiology, what's normal anatomy. And then as you become more embedded within the process of CBL, and you have some learning behind your belt in year 1, in year 2, we start introducing diseases. So your cases will be maybe a little bit more complex. You will have cases with patients presenting with symptoms, and then you work your way around those cases. And then CBL happens in year 3 and 4 as well, where you'll be doing CBL within the wards, and those cases will probably be weekly cases. So, for example, if you're doing your pediatrics posting, all the cases in that block will be pediatric-based cases. So you'll be by the end of medicine, you'll be very familiar with how CBL works at Bristol. So I thought what would be really interesting is to show you what a case looks like. So this is half of a year 2 case, what we call a chest pain case. So in one of my roles, I also lead one of these CBL groups. So this is what the information will be presented to the students. And in our first session, we all sort of come together, and then we read through the case together. So I'm aware that you're all interested in doing medicine, and you're not haven't quite done medicine yet. So I'm not expecting you to know a lot of these terms and drugs. So I'll read through this case and go through this with you, and then I have a little quiz after these next 2 slides, of a fun quiz. I'm hoping that you guys will take part in it. So this is a case in year 2. It's called chest pain. So it's a 52-year-old man who's developed chest pain during a stressful meeting at work 2 hours ago. Sorry, I'm just trying to find my mouse. Yeah. Okay, so they have central chest pain during a stressful meeting. He's 52 years old. He thought it was heartburn, but it just kept getting more painful despite him taking Gaviscon, which is for heartburn. So he describes the pain as being a tight band around his chest, a really painful chest, and the severity is 10 out of 10. So 10 out of 10 of pain scale rating is the worst pain in manageable. Imagine, so he's never experienced pain like this before, so it's really painful. And also he's feeling a bit nauseous. So it gives you a little bit of information about the medical history. So he's got hypertension, for which he's described ramipril. So that's an ACE inhibitor. He's obviously got some family history because his father also has had a myocardial infarction or heart attack at 58 years old. He's a smoker, so he's got a smoking history of 20 pack years, and his aunt also has angina. And then you get some information, he arrived at the ED and there's a rapid A to E assessment. So A to E assessment, you've got looking at the airway. So his airway is fine. He's got ventilation. His breathing is fine. His SAT's 97%, which looks fairly all right because it's 95 to 100% is pretty normal. His breathing rate is 16 breaths per minute, which is maybe on the high side, but 12 to 16 is normal. His capillary refill is less than 2 seconds. So capillary refill is when you press your index finger hard, and then you can see that it goes a bit white, and then how long it takes for it to return to like a reddish color. So less than 2 seconds is normal. It's got a regular pulse rate, and blood pressure might be a little bit high. He's alert, his pupils are fine. His temperature is maybe on the low side, 36 degrees. He's distressed, pale and sweaty. He's got nicotine stained fingers, suggesting that he's quite a heavy smoker. And he's got xanthelasma of the eyelids, and his blood glucose is pretty average, something between 4 and 7 millimoles is fine. So what we do during the CBL is that we actually look through it, and we look through and we highlight, and this is exactly what I've done here. We highlight things that we maybe not so sure about, where the students might then go away and look up and do some research. So for example, what's the definition of angina, what's the definition of myocardial infarction, things like that. So we work together as a group, highlight the things that we're not so clear about. So this is just the second part of the case, which I'm not expecting you to sort of know because it gets a little bit more complex. So they do some examinations of the cardiovascular system. So he's not got an elevated venous pressure. There are no heaves or thrills. They can palpate his apex beat, and upon exaltation, he's got normal heart sounds. And then basically the doctor on ED has decided that it's a diagnosis of acute coronary syndrome, and then recorded an ECG. And then again, the students will then go through, what does this ECG look like? And so this patient has a provisional diagnosis of STEMI. So that's a type of myocardial infarction. There's different types of myocardial infarction. He's then given drugs like to thin the blood, vasodilators, so aspirin, ticagrelor and GTN spray, and then also given some pain analgesics, morphine and vasodilators. And then the patient's then taken to a laboratory for angiography, primary percutaneous intervention. So that's basically putting a balloon through the coronary arteries and a stent put in as well at the same time. So the door to balloon time was 30 minutes. So door to balloon time is the time from which the patient presents at ED at the door to when a balloon is put into the patient in theatre. So what happens usually is at the end of one of these CBL sessions, we have 3 sessions. So the first session we go through the case, and then we sort of like divide up the work. People, allocate the students to say, oh, you're going to look into that, I'll look into that sort of thing. And then the second session, we come together and we all present our findings. And then we sort of go through the case. And then in the meantime, there might have been more information about the case that's come through. And then we go through the extra information. And then we have a third session where we then wrap up and any other unanswered questions get resolved. And then the third session, we wrap up the case and then we sort of conclude the case. And then that happens over 2 weeks. And then the next 2 weeks you get a different case. So for example, this is a chest pain case, you might get a neuro case next, or a dermatology case. So I think we got quite good there. So what happens also in that third session, our students, or my students actually, they actually write a Kahoot quiz based on the case themselves. So for them, it's a bit of a revision. So they all write questions, someone hosts a quiz, and it's, like medical students are quite competitive. So there's a bit of friendly competition going on as well. But also it means that they get a chance to write questions and it helps them revise. I mean, they're not like really competitive. They, it's a bit of fun. And it's just a little bit of fun to end the third session. So I just want to demonstrate what happens also in the follow-up. So within the case, what happens that more information gets released. So so following this case of this man, we get some sort of results. So he's got a thrombus, a blood clot within his left anterior descending artery. So this is an artery that supplies to your left ventricle of your heart. And it says that then the patient was treated with balloon angioplasty and stenting. So he had a balloon placed within the artery to expand it, and then a permanent stent to put in it to keep it open so that you can get appropriate blood flow to the heart. And then an echocardiogram was examined to examine if there was long-lasting damage to the left ventricle. It was found to be normal. And then the patient made a full recovery on the coronary care ward, and then referred for cardiac rehabilitation, encouraging him to do exercise. And then he was prescribed all these various medications for secondary prevention. So I hope this case gives you a sort of like an idea of what CBL looks like. So it provides literally a learning framework for the students to sort of go through and learn about the cardiovascular system. So there's a bit of history. So you learn about history taking, looking out for signs. So things like the age of the patient, the smoking history, his sometimes occupation is very pertinent, what sort of medications he might be on and what sort of family history he might have. You also within the case, you get symptoms and presentations. So again, those are clues that help you decide what sort of diagnosis or what sort of avenues you want to go down to explore. As you could have seen, as you saw from the case, there's lots of medications that get put out. So what the students quite often do is that they look at the drug names, work out what the drugs do, why you would want to give those drugs to the patient, and also the pharmacology of the drug. So you also drill down to the molecular level, what receptors do these drugs work on, and how do they actually help treat the symptoms or treat the disease. You also have the investigation. So in this case, things like the echocardiogram, the ECG, learning what they actually do, and what what the results mean and interpretations of those results. So ECGs, for example, was the learning objective, one of the learning objectives of this case. And then finally, you have the interventions. So how would you go about treating disease? How would you manage long-term, acutely and long-term, a presentation like this? So it sort of like wraps it up nicely. And then quite often we also have helical themes that run alongside these cases. So, for example, in one of the other cases, it could be like a drug user, for example, and then we'll look at like this sort of like social issues around drug use, etc. So I hope this gives you a flavor of what CBL looks like. It's not just CBL that you do within medicine at Bristol, but it's one of the ways that you'll be learning medicine at Bristol, and that runs through throughout the MBCHB curriculum. So that's the end of my sort of example teaching session that you might have. Please feel free. I think Sumi's popping some monitoring the chat questions in the chat. So the next rest of the presentation, I'll talk a little bit about Bristol Medical School and and a little bit about what studying medicine's like at Bristol. So the medical school is based in the Faculty of Health Sciences. So this encompasses the dental school, the veterinary school, and the medical school, and is underpinned by the School of Anatomy as well, which services all the three professional programs. So the Faculty of Health Sciences is got really good quality innovative teaching and in an excellent research environment. So we are a research intensive university. So you'll find that we are at forefront of biomedical research. We've got really good population health studies and research going on in the medical school. So we're not just a teaching institution. We're also a very heavy research institution, which means that there are world-leading researchers. We've got dedicated teachers. We've got clinicians who participate in clinical research programs, and a whole wealth of different types of students that come to us. You get the researchers, you've got the medical students. So you will have opportunities to do medical research within Bristol Medical School. Bristol is one of only two UK institutions which offers all three undergraduate clinical programs. So we have students that study dentistry, students that study vet sciences, becoming a vet, and of course medicine. So and these are all professionally accredited. And it's really interesting because we offer all three professional programs, we can share good practice. So good ways of teaching clinically or pre-clinically, and we also share a lot of the resources. As I said, School of Anatomy underpins all the three professional programs. And in addition, we also have strong and collaborative partnerships with the NHS, and so we have two of the major hospitals within the region. So Bristol Royal Infirmary on the left here, and Southmead Hospital. So these are the two major hospitals within the region. But we also partner up with smaller hospitals in the region, in the southwest, and you'll be experienced teaching in some of the smaller hospitals as well. So the Bristol Medical School, we've got a new undergraduate medical curriculum. So about 5 years ago now, we overhauled our medicine program, shifting away from the traditional 2-year preclinical and then 3-year clinical to just a 5-year program. So you will be embedded within clinical teaching from the first year of the medical program. And this is really to equip students with skills to deliver healthcare services in the 21st century. So we've modernized our medical curriculum. In addition to the undergraduate program, we also have 20 postgraduate taught programs. So we've got MScs in public health, epidemiology, translational cardiovascular medicine, stem cells and regeneration. And you may be thinking of doing one of these master's degrees, but also what it also means is that we've got loads of researchers, we've got loads of teachers and clinicians who teach on these programs. There's a critical mass of individuals or people who are involved in healthcare related programs within Bristol. And as I said before, we are very strong in research. Medical research within Bristol is very strong, and we have lots of collaborative and multidisciplinary research in population. So, big population cohort studies or epidemiology studies, and also in translational health sciences. So down to molecular level, stem cells, and molecular treatments. So we do lots of teaching and research. So a little bit about MBCHB curriculum. It's an innovative curriculum incorporating the best of modern medical education. So we've really embraced the modern way of learning, so with CBL, but always thinking of patient safety at its very core. So this is what MBCHB would look like. So it's a 5-year program. So in the first year, you have an exploration of human health and well-being. So really basic physiology, anatomy, biochemistry. But as I said, within the first year, you will start doing things like effective consulting days. So you will start experiencing some clinical placements. Once you've got your basis, you move on to year 2. You will then have effective consulting clerkship. So you will be placed in for some time in primary care. So with the GPs, you also have a student choice placement, and then the cases get a little bit more complex, symptom-based learning. So you start, embedding things like presentations, diseases within your cases. In year 3, you'll be then embedded within your clinical placements, and you'll be learning from patients going through scheduled and unscheduled care within the hospital and community setting. So you will spend a day a week with a GP, and the rest of the 4 days you'll be based in hospital-based learning. A lot of our students take a year out after year 3 to do intercalation, which you may or may not have heard of. But basically, what happens is that they come out of medicine for a year, they intercalate, and they complete either a BSc or a BA or MSc or MRes within the year. So they get a second degree, if you like. And it is really an opportunity for you to do something a little bit different, but at greater depth. So you could do a BSc in neuroscience, or you could do an MSc in public health, or even a BA in medical humanities. So doing something a little bit different, or bioethics, doing something a little bit different from the core medicine that you experience in MBCHB. In year 4, you'll be looking at exploration of life from birth to end of life care. So we have a big block in complexity of conditions in older people, what we call complex medicine for older people. So this is where you start integrating all your knowledge. You're not just looking at specialties where it's just cardiovascular. You need to, or urinary. You need to actually integrate information across different systems. So these tend to be the specialty clerkships. So you'll be doing obs and gynae, pediatrics, psychiatry, and complex medicine for older people. And again, still spending that 1 day a week in GP or primary care. So our final exams, our finals, are at the end of year 4. So you'll be sitting your finals at the end of year 4. And the vast majority of our students pass and then go on to year 5. So at the start of year 5, you have an elective period for 2 months where you can undertake a project anywhere in the world, something that interests you. But the majority of year 5 you'll be spending in practicing being a doctor, really. So what's what we call a mini F1. So you'll be spending a huge block in primary care, a huge block in acute and critical care, and a huge block within a ward, so that you are well prepared to be a doctor when you leave medical school. So this is what the program looks like. We mentioned student choice placements. So throughout the curriculum, we have opportunities for you to step outside of the core curriculum of medicine, and provide you with opportunities to choose something that you would like to do. So a piece of project, or a bit of research that you might want to explore. So you can choose what you want to do, who you work with, and where you work. So you might want to do an audit, for example, a clinical audit. You might want to explore art and medicine, or you might want to do some research in the laboratory. So, really, it's really up to you what you want to do. But what we sort of emphasize is it should be a rewarding experience. It should be fun. It should be educational. It's just something, outside of the core medicine curriculum. And you'll have opportunities to do that throughout the curriculum. You also have the option of choosing to do Inspire program. So Inspire program is a research taster program. So you get within summer placements within labs or within clinical research groups to do a little bit of research, 4 to 6 weeks. It just gives you a taste of what research is like, medical research, biomedical research, or clinical research is like. And of course, as I said before, you have the option of stepping out of medicine for a year to do an integrated degree, to get a second degree, even BSc, BA, or MSc degrees. So we talked about CBL. So how will you be studying? You'll be doing a blend of learning methods, including lectures, practical sessions, and CBL. So CBL will underpin, the way we teach, but you are not just going to be doing CBL. You'll be supported with lectures. You have tutorials, you have practical sessions that will support that CBL. So, and then actually within the year, you won't be doing CBL for the whole year. It will only be for probably 3 or 4 months, so year 1, there are fewer cases, and year 2, there are a lot more cases. And then the rest of the time, you'll be doing things like effective consulting and being in awards, etc. So as we said, CBL, you do your learning in groups of 10 to 12 using case scenarios. And I've explained before, we meet 3 times over a 2-week period, and we discuss the cases and help each other learn and do research. And each group is facilitated by an experienced academic, so someone like me, which provides the support and guidance. But we always emphasize to the students that, we're not there to teach you or tell you what to do. We are there to guide you. And really, as a group, the students find it really helpful where they sort of learn together, but it also encourages that independent learning, and it makes you really good at looking for information yourself and learning and finding out ways that you learn best. So, in addition to the taught sessions and the CBL sessions, we say you have early patient care. So you are involved clinically from year 1 of medicine. So within year 1, you will have clinical exposure through clinical effective consulting days and going on to GP placements. And what we also ask is students do a certain amount of healthcare assistant shifts. So you will be trained up as a healthcare assistant. You'll be required to work a small number of shifts as a healthcare assistant, so you get a holistic view of what medicine is really like within the NHS, from being a healthcare assistant to a consultant. So a lot of your clinical teaching will be embedded within the clinical academies. So these are learning and teaching facilities that are embedded within 7 NHS trusts in the region. So it ranges from small rural hospitals in, say, Taunton and Yeovil to the large city centre hospitals. So within Bristol, we have the 2 major hospitals that serve the southwest. And if you get posted to a little bit out of Bristol, we will provide free accommodation to students at the academies that are situated outside of the Bristol city centre. But you will get a mixture of both throughout your 5 years. You won't, just be posted to a rural posting for all of your placements. So. So this is a little video that academies are like.
We meet the students usually in their 2nd year, and they're very green, if you like, and they're quite nervous about coming to work in a hospital, and very, very quickly, it's amazing. And it's really satisfying to see these young people turn into professionals, into doctors, into colleagues that we're going to be working with, for the rest of our careers.
The way the academy system at the University of Bristol works is there are a number of academies associated with the University of Bristol in various places like Taunton, Bath, Weston, Yeovil. And for your clinical years at the university, you spend about half of the year living and studying in that place. So, for example, in my fourth year, I spent half the year at the BRI doing medicine and surgery, and then I spent the other half of the year in Taunton doing paediatrics and anaesthetics, and that was a really great experience.
Medical students, when they come to the academies, can certainly expect to receive a different educational experience in each academy, because everybody will do it slightly differently. But the strength of the system is that the students move around the academies during their course. And so as a result, they're able to see and experience lots of different ways of being taught, see different ways of doing things. And I think that's very positive in itself. We all have to develop as learners. You have to find out what your learning style is. And I think the academy system gives you a real opportunity to see which things help you, which things you'd like to develop, and very positive for the future as well, when hopefully when you've qualified, you'll get involved in education in your turn, and you will have had the chance to experience very many different sorts of educational styles. That's incredibly positive.
So the advantage of academies, one of the advantages when I started working as a doctor was recognising that different hospitals work in different ways, and that those ways aren't necessarily better or worse than one another, but having the flexibility to kind of embrace different ways of working, and also reflecting on those different ways of working and trying to bring that into practice in other places where you're working too. So if you see something really good happening in one hospital, and think about how you can get that working in other hospitals too.
I also found clinically it was really useful to see different specialties in different places. All the hospitals vary, and it's useful for future practice.
At the different academies, they get the chance to see a different side to the NHS. And I think as a result, by the time they qualify as doctors, they're much more used to the system that they're going to be working in. And in the same way that junior doctors have to move around from one hospital to another very frequently, our students are prepared for that. And they get the benefits of seeing different ways of learning, different ways of teaching, different groups of patients, different environments.
Brilliant. So I think it was really well summarised by Justin with at Bristol Medical School, the clinical academies. You're going to get experience of different ways different hospitals work, and we find that the students really enjoy, being sometimes in a rural hospital, sometimes in the major hospitals. So it's a great experience. So all our MBCHB program is accredited by the General Medical Council, and we get reviews from GMC very frequently, and they were very complimentary about our new curriculum that we overhauled 5 years ago, and felt that there was a strong system of support and learning environment. And what do our students say about our medicine course? So this is the National Student Survey from this year. So literally we got these results in July. And so this is a survey that students fill out across all medical schools. And out of the 31 medical schools, we were first for overall satisfaction. We get assessed on 8 domains, and we were first for 3 of them, teaching on course, learning opportunities, and student voice. And we were second for another 3, assessment and feedback, academic support, organization, and management, and we were in the top 10, 15 for the other 2 domains. So our students really enjoy being at Bristol and doing medicine at Bristol. And here are a couple of comments that I sort of fished out of the survey. I'll let you read through this. I won't bother reading it out. But basically, I think our students have felt very supported during COVID-19. And we like to pride ourselves on being a very approachable medical staff, and we work well with our NHS partners within the clinical academies to provide the best education that we can for you within Bristol. And yesterday in the Sunday Times Guide, the Good University Guide for 2022, we were placed 5th within the UK for medicine, and the Guardian Guide, we were top 10 for medicine. So Bristol's a good place to come and do medicine. So being a doctor is interesting, which is why you're all interested in doing medicine, because it's a very rewarding career. You can make a real difference in people's lives, but it's also challenging. So, so you're all obviously interested in doing medicine. So what can you do when in your preparations to apply, if not this year, next year? What we always say to potential applicants is talk to doctors. So talk to your own doctor or family members or friends who may be doctors. Talk to patients. Everyone's a patient, right? So, you can talk to your family and your friends, say what actually makes a good doctor, what do you want in your doctor, and think about how you can have those characteristics to be a good doctor, which should not always necessarily mean that you're academically bright. A lot of it is communication with people. Look into what a career involves, because it is a challenging career. You have to do night shifts, etc. And if you can, obtain some work experience so that you can see what it's really like. But we do appreciate that not everyone has the opportunities to shadow a consultant in the hospital. So any type of work experience that you can relate to medicine, be it working in a care home or even being a waitress, because you have to interact with sometimes unreasonable people, that in itself is some sort of work experience that you can use in your interviews. And then, of course, if you can, read medical publications to keep up with the latest health news and politics. So, so we accept applications through UCAS. So as with all UCAS deadlines, applications are due on 15th of October. You have to be 18 and above when you actually start medicine. Just a note to say that we no longer read personal statements, but they may be considered where two applicants score identically. So here are the entry requirements that you can get off our website. So of course you need to fulfill some of the A-level grades or equivalent, so IB or other international qualifications in addition to A-levels and IB. So SUMI will be the best placed person to advise you on that. Once you meet the grade requirements, you also need a UCAT score. So once you meet the grade entry requirements, we then look at your UCAT score, and then we basically invite people for an interview at a cutoff score for UCAT. So for 2020 entry, for example, the cutoff score for UCAT was 2,690. But it's still really important to say that this number will change from year on year. So it's not a fixed cutoff score. It will vary from year on year. So we invite probably about nearly 1,000 people over for multiple mini interviews. So we do MMIs, which a lot of other medical schools do now. So I can say for sure that usually MMI formats are a 7-station format. You move from one station to next, and you get face assessors, which will interview you, and you get 5 minutes per station. So given the uncertainty of COVID for this coming cycle, we are sticking with online MMI. So we won't be requiring anyone to come to Bristol to do MMIs. So there will be 2 assessors, and there will be 6 stations, but there'll be the same assessors, but 6 questions, if you like, which will assess your qualities and values, and assessors will judge what they felt would be good, what qualities you have, which would make you a good doctor. And the final decisions are based solely on the performance at the MMIs. The assessors can be academics, it could be clinicians, could be patients, or senior medical students. And about 40% of people who are successful at MMIs will receive an offer. So if you don't get an offer for medicine, you may also get alternative offers for biomedical sciences at Bristol, for sure. But just to say also that we don't do clearing for medicine, so you'd have to reapply if you were wanting to do, for sure, medicine at Bristol. So if you do join Bristol, I'd like to welcome you to Bristol Medical School. We like to pride ourselves as being lots of culture and community within Bristol Medical School and within the University of Bristol as well. So we're vibrant, we're diverse, we've got lots of people from all nationalities coming to Bristol. It's a safe city. which you probably hear a lot from Sumi. And as a medical school, we try to be, we aim to be supportive and will support you through pastorally and give you support academically as well. And it's collaborative. We number one, for student voice, we like to consult our students, on things within medical school, and also the learning's collaborative. We've got lots of students, for example, who have published papers together with researchers within medical school, and also learning is collaborative. The Galankals is the Bristol Medical School's student society, and they host loads of activities that really support your learning and extracurricular activities at Bristol. So you can know anything from academic advice, from careers, finance, revision, lots of societies like surgical societies, dermatology society, etc. But there's also societies for stuff that's not related to medicine, so charities, clubs, sports, music ensembles, wine tasting, I don't know, cheese eating, whatever, anything you want, you name it, you can have, and the Galankals are really there to help support you. I just thought I'll put up the costs of the fees for next year, but you can get this off our website. So the vast majority of our graduates go on to 2-year clinical foundation programs after they graduate. So they will get full registration with GMC, and then they apply for a foundation program within the UK. And from 2023, nationwide as UK, it will be a UK requirement to do the medical licensing assessment ahead of the foundation program. So you can find out more from our web pages, which is here, or you can email Sumi, who's got loads of questions, who will be able to answer questions as well as I can, I imagine, about medicine and applying to medicine. And thank you very much.